Hello and thank you for joining us on the Monday edition of Journalists Hangout. I'm Ayodele Ozugbakun. Today on the program, Nigerian doctors begged President Buhari to call Kogi Governor to order as Nigeria surpasses 10,000 confirmed cases of coronavirus with 14 new deaths. I'll be hanging out with Babajide, Kolade-Otitoju and Asuquo James. So if you're ready, let the hangout start now. Thank you for joining us. The COVID-19 roller coaster ride in Nigeria's north-central state of Kogi appears to have reached a crescendo after initial denial of confirmed cases of COVID-19. The state government has confirmed its first case of the virus. The Nigerian Medical Association, NMA, had earlier urged President Muhammadu Buhari to call the state governor, Yahaya, Bello, to order over his claims that were no cases of COVID-19 in the state against results released by the Nigeria Center for Disease Control and CDC. President of NMA, Francis Faduile, said the problem has nothing to do with politics. Babajide, when we started out and we said this thing was, even NCDC said we're going to have it in 36 states. It was just a matter of time. So it's not something that we should take pride if we have or not. It's just getting solution.
There's no trophy for having fewer cases or not having a case for weeks. There's no trophy. So let's just fight the battle as one people.
So what does the NMA want now?
No, what the NMA is saying is that the governor of Kogi State has been endangering the lives of health workers, endangering the lives of the citizens.
How?
By the manner in which he continues to frustrate the fight against COVID-19. Ideally, and what the law says, is that it is the NCDC that will coordinate the battle, the response, the national response to a health emergency. They are permitted by law to do that. We have a situation in which the NCDC went to your state and you said they should quarantine them. When Kano had a big problem of COVID-19 and people were dying, we challenged the NCDC to go and help them. The WHO and the NCDC raced to Kano and set up testing parameters for them. The NCDC DG, Ihe Kwazu, was there. We ran the story. We didn't hear Ganduje, who in any case needed help, saying that, oh, Ihe Kwazu, oh, welcome, Mr. DG. First go and do 14 days quarantine. If every state in Nigeria, because NCDC is their duty to certify your testing site, and then the testing can go on. If at every state you go as NCDC staff, you are quarantined, will they be able to do their work? What kind of ridiculous measure was that? That they should first go and quarantine because you wanted to continue to insist against logic, against science, that in your state there has been no COVID-19 case. That is what you wanted to continue to insist. But the way by which we can know whether you indeed have that case or not is to allow testing to take place. You can't be suppressing testing and be telling us that, oh, there's no COVID-19 in my state. I mean, it is even revolting against logic to say that Kogi State, that shares borders with 9 states, and then she has border with Abuja, that is already at that time, at a point even they had 500, more than 500 cases, to say they don't have any case. What have you put in place? In Kogi, people move around, they don't use face mask, they don't care whether they wash their hands, their level of sanitation is not better than the rest of the country. Many people still indulge in open defecation in Kogi. So what have you put on ground that we can see clearly is the reason, oh, you do not have any case. The only thing you have put on ground is suppressing testing. Suppressing testing. This is the fact. Because the structure is that when medical workers raise an alarm that so person came to our hospital with suspicion of COVID-19, it is the health commissioner in the state that will come and have a look and take a final decision. So it is that power that they have been using. I said this a long time ago. It's that power. Oh, the commissioner will just go, no, there is no, this is not COVID-19. Oh, this is not COVID-19. COVID-19 that has breached international boundaries. You are telling us that a state in Nigeria will not have it. Let Nigerians be allowed to see your testing parameters. Let them see it. Now, even the imam, you saw the statement by the family of the imam. There has been a lot of attempts to use propaganda to suppress the truth. But the nature of the truth is that if you cover it at one end, it will come out at the other end. That is why when we say things here, they think we are fools. But in the fullness of time, people see that is the truth that we say. We have no interest in any of these political players. The truth now is that the imam, the chief imam, had not traveled out of Kogi State. So if someone like the governor of Kaduna State is so concerned that people are bringing the disease to his state, to the point that he's going to man the checkpoint by himself, the governor of Kogi, who has not left his government house to go and man entry point into his state, wants us to believe that there is no COVID-19. On what basis? With what parameters did you come to that? So those doctors are saying, look, you are endangering people's lives. This is mass suicide that you are preparing for. Because the consequences will be grave if we do not move fast. And I had said earlier that the president needs to talk to the governor. Because the governor wants us to believe he respects the president so much. So why is it difficult for the president to talk to him? How can a governor work against the realization of the goal of NCDC? What the law permits it, you stand against it, and the success of his work. So, but right now, it's the same governor who has now said, okay, we are locking down Kababuno. The truth is, you lock down Kababuno, they have gone to other places. Kogi has one of the highest number of filling stations in Nigeria. Filling stations, because it's a major terminus. It is the state that connects the south and the north. There's no state like it. So if Almajiri is coming from Kano, there are about 25 of them, about 16 test positive. They go into a state, the 16 test positive. You should know that where you have a state, where thousands of people are moving into that state and coming out of that state, there is no way that that state will not have COVID-19, except we continue to deceive ourselves. And there's a limit to which we can continue to deceive ourselves.
Asuquo, now looking at this now, Cross River at a point in time too, even till now, still claims that they don't have a case of COVID-19. And at a point in time, it's looking as if we want to introduce an element of politics into this.
Exactly. You know, just like BQ has, I can see that BQ is really, really angry.
No, it's my people now.
You know, because
Even though I'll keep saying that it's my new state,
yes.
But I have my
family. You know, yes.
So I watch them die?
So it becomes, if you look at this situation, there is nobody that won't be angry. You know, because if you comparing Kogi and Cross River, who claim that they don't have cases, in Cross River State, when the incident happened, when Akwa Ibom, there were even stories that somebody in Akwa Ibom had. Immediately, the governor shut down the state, closed everywhere, and ordered it was mandatory. If you don't have face mask, you'll be arrested. You understand?
You are not presenting the story
No,
accurately.
no.
Your governor and his people first denied.
No.
They first claimed that figure was wrong.
Cross River.
This Cross River. This Cross River.
I'm talking about Cross River.
Your governor.
No, of course, he denied
first
first. He denied.
But they ate their words.
Of course.
And they admitted that it was a health outreach.
Exactly.
That took place in the state. From there that the white people infected Akwa Ibom people.
Exactly.
But you first started by abusing the NCDC and saying, no, it's a lie. We are used to politicians accusing NDC of lying, NCDC of lying, but in the fullness of time, the truth, by its very stubborn nature, comes out. So
Exactly. So if you see, so I'm even looking at the two states that deny that they don't have that claim that they didn't have any cases. Cross River closed down, but Kogi till date, apart from just yesterday that they decided to close one local government, just one local. So why are you closing the local when you are saying that you don't have
what's
any
the
case?
essence of
Even till
closing
today, the CPS was saying they don't have any case, no positive case. So,
And so what's the essence of
so
closing
why are you closing the local government? And well, there's no how that Kogi State will say they don't have a case. And just like you are saying, it is better that the president calls the governor and tells the governor, allow the NCDC
to do its work.
Do its work. Enter the state, make sure that test is carried out. Kogi has carried out only one test.
Oh, no.
That the NCDC
That
can
the
confirm.
NCDC has confirmed.
But they are claiming they've done 111.
111. You know, so who? You can't. And meanwhile, they don't even have the facility to even test because they still have to go to Abuja to do the testing. You know, so how did you conduct your own test?
Who certified their
how
test
did you
center?
conduct your own?
Because it's NCDC that certifies test centers.
Exactly.
Who certified their
You
own?
understand?
So it's an audio test center. That's
Okay.
what it is.
So the thing is, we shouldn't play and laugh over this thing. Don't keep your people in the dark, because the thing is, once these infections enter the states, people are not aware, because the sensitization in Kogi is extremely low.
It's zero.
You understand? So people don't even know, because once people are going into the states, they are not wearing face masks. If you are wearing face masks in Kogi, they will look at you as an alien.
As a masquerade.
You understand? But in Lagos, it's just a normal. People are now saying, my face mask, I've forgotten. Then you wear. At gatherings everywhere. But once you get to Kogi, it's different. Why is it different? Because the governor has decided to just stay on his own, believing that because he's the governor, his people does not matter. And this is not good. Because it is absolutely not good at all.
Jude, he has already taken the step. Governor Bello has ordered a 14-day total lockdown of Kaba, Bono, effective from the midnight on the 2nd of June. What will this measure, what will it amount to? How strategic is this Kaba?
I've read the thing. It is too little. Too little. You cannot simply, because he assumes that the index case, forget about the press statement where they are still conning themselves that, there's still no COVID-19 in Kogi. The question is, why did you impose a lockdown? Your lockdown is not a preemptive measure. Your lockdown is a reactionary move. You've reacted to the reality that you are dodging all the while. Now, it is not. So if the press secretary, very likable character, Onogo Galacticos, if he says, there is still no COVID-19 in Kogi, he knows in his heart of hearts that he's deceiving himself. Even if you are told to write something, it will still be eminently clear to you in the inner recesses of your heart that you are deceiving yourself. So we leave that. The truth is, people have been moving in and out. So if you want to lock down, you can't do piecemeal lockdown. Other people did not do piecemeal lockdown. They did not do piecemeal lockdown. But you allowed the horses to bolt from the stable. At the point when everybody was locking down, you are saying that you are promoting COVID-19. I don't understand the meaning. What is the meaning of promoting? We are fighting it. We are not promoting. That's not the meaning of promoting. We are fighting it. We are alerting our people to the dangers. Somebody say, when Jide talks on Journalists Hangout, it makes it look like it's a death sentence. Of course, that's rubbish. That's not what I do. I don't want 100,000 Nigerians to die the way they have died in America. I love my countrymen and women. I don't want them to die. I don't want 38,000 people to die in Nigeria the way they have died in the UK. So you can deny all you want in our country, but the reality is that it's killing people over there. And I have lost classmates. I've said it, a professor who was resident in Kano. We graduated the same year from the University of Ilorin. We lost him to COVID-19. It is when it gets to your door that you know that this thing actually exists. Someone once said something that he said, you will believe in miracles where you need one. There's something that Nigerians don't try to trivialize. We have lost people. So it pains us to watch people trifle with a matter of life and death. We've seen big people lost to this thing in our country. Of just last weekend.
Exactly.
Yeah, just last weekend.
Just last weekend, yes.
Big man in our country. A first-class material. He came away in first class in the university. He served this country. And we lost him to COVID-19. And people will sit in their homes and be saying, no, COVID-19 is not, it does not exist. It's a scam. What is scam? You think that everybody is fraudulent. Do they even know Ihekwazu? Do they know where it's coming from? From an illustrious family? Is it every Nigerian that is dubious? You just tie everybody with a brush of corruption? Because they are saying the truth? Because you hate the truth so much? No. It shouldn't be happening in our country.
Okay, I have my first caller. I think Ayo is calling us from the United Kingdom. Thank you for joining us, Ayo.
Oh, good afternoon, sir. I have been trying your channel for over a year, so I'm so glad I came through today. Wow. Now, this issue of COVID-19, obviously, I live in the UK and it's very, very real. So I just want to appeal to everybody in Nigeria, people in authority and people who are not, to be very, very faithful in what we do. This is not something that we can handle with sentiment. We need to allow people to be tested for the benefit of all of us, because so far Nigeria has been lucky, but the way things are going, we just need to handle with caution so that people get tested and get treated or whatever needed to be done. So this is not a point to shield anyone from testing. Thank you very much.
Thank you.
There is something else I want to say, please. You had a story sometimes about some policemen that were killed. If it is in another country, there will be a fundraising for them. So if you can start a worldwide fundraising for the family of those policemen that were murdered, when you are doing the Wadume story, and people might be willing to contribute for the benefit of their family.
Thank you.
Thank you.
Thank you, Ayo. Thank you.
We are still chasing justice for them. We are still challenging the army to produce the army captain who has been accused of being involved in their murder. So, in the fullness of time, we expect the army authorities to hand this captain over.
Asuquo, now, our COVID-19 case, we have over 10,000 now, and we begin to look at this figure, and it's almost like a normal when we see it, but something keeps telling me that the way it's going, we are going to push 100,000 if care is not taken, and there's no indication that this, the situation it will come down anytime soon. As NDC reports 307 new infections. So totally we have 278 deaths.
Ayo, don't forget that on the 30th of May, we had the highest infection, which was about 553.
Yeah.
And that one was just a tip of the iceberg. The thing is, we have not really gone ahead to test like we are supposed to. As in testing like 1 million. If you test 1 million...
We're paying lip service to this testing capacity. Yes, exactly. We're not expanding it the way we're meant to expand it.
Exactly. Okay, we are talking about Kogi now. That is a state that doesn't want people to be tested. So if, for instance, the federal government has the capacity to test 1 million Nigerians in a day, we'll be able to know, because we have not even gotten to the peak. We have not, the figures have not risen to where it's supposed to.
I think it's projected that we have 130,000.
That is Lagos telling you that we are going to even hit 120,000.
Lagos.
That is only Lagos, So, and that is, they are also looking at, if they have more testing kits, they can test more people, then they will discover
more people.
It's either they get to that figure, that is projection, or they don't get. That is projection. For Nigeria, we don't know. Whether it's going to hit 1 million, we don't know. But what we are saying is that they should provide enough testing kits so that all the states, they must enforce that all states begin to test everybody. So that by then we'll be able to know, okay, what do we already, the bed capacity is already filled, so we don't even want to even talk about that one. Now we are begging hotels and begging churches to give us facility.
In isolation centers, we
so
don't even have enough isolation centers
so,
across the country.
By the time we do the testing, Ayo, we'll now know that, okay, we have 1 million people. How do we now accommodate these 1 million people that are infected?
How can we accommodate 1 million?
Look at even Wuhan, like Wuhan that even started the whole thing. In 10 days, they were able to test close to 6.5 million people.
Wow.
You know? So
Wow.
how did they do it? It's because they have the capacity. They said, okay, everybody brought different ways of testing, and people got tested. First, it started the first day they tested 113,000. Then it increased in 10 days. So if Nigeria can bring out, if the federal government can bring out all that they need to test, the testing kits out, people will now go. In fact, I am even suggesting that if the federal government has the kits, they should now force people, like we used to do during elections, force people to go and line up, social distancing, go there, test, they write your name, this person. So then they go ahead, test the samples, then people will now know if I'm positive or I'm negative. Then from there, everybody will now know the real numbers, because these are not the numbers. People are carrying it, but they don't know.
Yes.
All over the place.
Everywhere.
People are dying.
People are dying. Some people will just say,
a lot of people have died and unofficially died.
Of course, nobody will know. You understand what I'm saying? So I think the federal government should brace up. The numbers will get higher. Nigerians should also brace up. Now, they have already relaxed a bit. Now it's going to be between 10 p.m. to 4 a.m. Bam. But once it's 8 o'clock, 10 o'clock, you still see some people going to drinking parlor to go and drink.
Until they arrest them.
You know, after 10, this is now the time that they will now know that people are very free to do whatever they need to do. Interstate travel ban, we've been shouting and shouting and shouting. People are still traveling.
Governors were complaining that the interstate travel ban has collapsed. Meanwhile, they
are also traveling.
They are traveling.
They are traveling up and down.
For one peace move or another. Going to
understand?
Abuja to see the president.
So if you
going
are
to
leader,
Lagos to beg for one of their colleagues.
You have to lead by example.
Are you not traveling yourself?
You are supposed to lead by example.
You are traveling yourself now.
Because me, if you arrest me, I'll say, but my governor went to Lagos or he went to Abuja.
Yes, now.
He's supposed to say, let's fight the COVID together. You know?
The Presidential Task Force 6, the President's approval to open schools, churches, and mosques and others. Right now, I think they've thrown it to the states, Babajide.
Yes.
And because for a long time, some church leaders, they've been agitating that, look, we need God. We need to worship God in that space called the church.
Yes, we need to take this seriously. I was talking about the man that we lost on Saturday. 2 of his aides also died as a result of COVID-19. That same man that we lost, who served his country diligently in the oil sector. 2 of his aides too died of COVID-19. It has reached the point that we have to take this seriously. Nobody is saying that it's a death sentence. Of course, even the death rate is about 1%. But people do not deserve to die when the thing killing them is preventable. You understand? Why should people die cheap death? This is something that is preventable. So this is the point that we are making. Let governors do what is right. If you want to let churches open, then the capacity for enforcement, you must have it. We must have it. If they are not ready to abide by the protocol in terms of social distancing, because we have not defeated the pandemic. Don't throw Nigeria open when we have not defeated the pandemic. So if they are prepared to abide, so be it. If the mosque are prepared to abide by the social distancing and physical distancing principle, you can let them open in those states. I know that our governors have come under pressure. We are a peculiar nation. That is why a Saudi cleric was telling Nigerian Muslims the other day that why are you people behaving in this manner? In my own country too, I've not been able to attend Jumat prayers. But I know the pressure that Nigerian leaders face, right from the president down to the governor. But it has to be made clear to this. Nobody is saying don't worship. Of course, we need to worship God if we believe in God. But we also have to be realistic that we must not endanger our own lives because we want to go to church or because we want to go to mosque. Those protocols must be enforced. If we are in a situation in which we cannot enforce them, then let us continue the way we are. The heavens will not fall.
All right. We'll take this breather. When we come back, we'll talk more. It's still Journalists Hangout. Stay with us. Welcome back. If you're just joining us, this is Journalists Hangout. We're reaching you live from Television Continental here in Lagos, Nigeria, and we are looking at the COVID-19 pandemic still in Nigeria right now. Now, what we are having is that, we're talking about lockdown in churches, mosques, and some schools, because it's inevitable that people will need to go back. But in Lagos State now, Lagos State is coming up with, okay, are you going to process of registration? And, you know, there was a time we had to look at it and said, look, this is a long process, but still, how do we maintain social distances in churches?
Well, if it's for churches, I think that one can be a little bit workable. That is if you don't have large numbers. You know, if you're a church of maybe like 100, you can decide to split the services instead of doing all the Thanksgiving, what is it called? Offering for, there are some churches that you go to and they want to do offering at like 3 or 4. So you can reduce it to only 1, you know.
Why are you particular about this offering? Asuquo, you are not even talking about services, eh? Maybe first service, second service.
You know, those
churches that is tithes and all that.
Those churches that are already used to, they're doing 3 hours.
Okay.
You know, for one service. So they can now reduce it to 1 and then make sure that it's just 20 so that they can have more services, like maybe 4 services, and then they can take. You can take that space. Maybe if it's for 100, they can take like 20. You will notice that they will have 20. So they can now have like 5 services and it will occupy their 100 members. But if it's for them to say that they want to now do just 1, then do the same preaching, offering, and Thanksgiving and everything for 3 hours, some people might not go to church. You know? Same with school too.
We are peculiar people, you know. It is in Nigeria we can boast of the 10 biggest, you know, churches. We have a space of 100,000 capacity, 60,000 of the warehouses that turned into worship center. So another one is in Port Harcourt now. He's very pained that he's not able to open his 120. That one now is
120. Okay, yeah. 120.
It's now bigger than
it's bigger than the
nature. But they've not allowed him to open it officially and everything. And this are the trend. So, like the crowd
if
is what we're talking about.
In the US or the UK, where churches were also opened, will they have the guts to take on the government the way some of them have been doing? What they can't do abroad, they simply come to our country because they think that the leaders are lenient, they just say what they like. Go to America and open your church by force. Go to the UK and open your church by force. Go there now and let us see what will happen. The repercussion of breaking laws there, we'll see it. That repercussion will be visited on you. But it's only here that we are piling pressure, even scientists amongst them who know the implication of people holding hands. They say, no, we must have services. Haba. Is it not about saving lives? Or it's moved away from saving souls to not caring whether they die or not? Haba, for God's sake. So this is the thing. This thing is a dangerous phenomenon that we found ourselves. The day, Saturday, when we recorded 553 new cases, UK, they recorded 416. So we have started overtaking people, those countries that...
They are recording fatality.
Yes.
More than us.
Because America, after America, UK has the highest rate of fatality. So new cases in the UK on Saturday was lower than what we recorded in Nigeria.
And we've not tested very well.
How many people have we tested? We said we are going to achieve 2 million capacity. We are so far away from 2 million. When you look at how much Ghana, how many people Ghana has tested, or South Africa, you see that we are way behind. And they still don't want us to say COVID-19 is killing people. They want us to join the people who suffer from borderline illiteracy, who are saying, no, it is a scam, no, it does not kill people, it's a lie, it is does malaria not kill people? Oh, you are comparing malaria to this one. Does it infect people? Does malaria infect people the way COVID-19 infects people? You are comparing it to pneumonia. Whereas pneumonia is just one package. COVID-19 encompasses those things that kill people through malaria, encompasses pneumonia, breathlessness, and other ailments rolled into one.
Respiratory problem.
Yes, that's what makes it dangerous. You don't want us to talk about it, but it's a lie. We will talk about it. We will talk about it.
Asuquo, it's as if we are relaxing in Lagos. As at the time that this lockdown started, as at the time that people were permitted to go to their work, partially, you will see a lot of people adhering to the face mask thing and everything. But when you go to the street of Lagos, when you go to the marketplaces now, the level of compliance have dropped considerably.
That is a fact, that people are now seeing it as, oh, it doesn't happen, or this thing is not happening again. No. The one thing I notice about Nigerians is that they usually have this fatigue. Once something starts, the next thing is they'll just forget about it completely. What we should be doing is, what the Lagos State government should be doing is to try and see how they can enforce it, especially the face mask, as small as that face mask is. Because we know the social distancing at marketplaces and at the churches, because it has not opened, and school, it has not opened. But marketplaces, which they have opened, both the non-food market and the food market, they have to enforce it. And then they must, as a matter of fact, enforce face mask. I know some supermarkets, if you don't have face mask, you can't enter. Now, and if they can enforce face mask and ensure that people who don't wear face masks are being prosecuted, having mobile courts to arrest them, not just putting face mask on your chin, no, but putting it on your face, so that once you start sneezing and talking, people will be able to, you will be protected, and other people will be protected. We need Lagos State to see how they can enforce this. Go ahead and also sensitize people. The sensitization has to be more now, because now that they are relaxing, trying to relax their economy, trying to reopen and telling people, if you want to now do your business, come and register, the economy will open. We pray that these infections, particularly in Lagos, does not go higher than what we are seeing now.
The federal government is trying to resuscitate, or they're trying to start local airline so that we can travel. We can move from Lagos to Abuja, not international, local first. And looking at what has happened before, the private airlines, they've been grounded for some time.
Yes.
Will the federal government, would they need to come to their aid, and how would they sustain their operations?
It's really tough on those guys, and I really pity them, because no matter what we say, we have to remember that jobs are at stake. And these are brothers, our sisters, whose jobs are in danger of being taken away by this disease. I listened to the little Kano man, Dr. Sane, saying that from June 21, that they will allow the airlines to start work. You understand? And he's saying that, okay, that after they put some measures in place, including social and physical distancing and all that, that by June 21, the airlines will be allowed to start domestic operations. And he mentioned something crucially, which is that they have to reduce the capacity.
That is more loss.
That means number of passengers that they can airlift. Now, what has been suggested is that the aisle, for example, that they could remove the seats. For airlines, this will make it impossible for them to break even. They suggested before, and some of those airlines said, look, if we do that, it will be difficult for us to break even. Because for them to break even, they need to achieve like 71% airlift of passengers. Now, by the time you force them to remove those seats on the aisle, they will come down to around 60%. At 60% airlift of passengers, they cannot break even. And these are airlines that had not worked for months. These are airlines that they are indebted to banks. They are indebted to banks. In Nigeria, they have to pay for what's it called? Their leasing fees. And a lot of what they do are denominated in the dollar.
Parking fees.
Exactly. Yes, you know now that even the dollar has appreciated rapidly against
400
naira. So they are facing serious problems. Now, there are implications of those measures that are going to be taken. It means that you spend more time at the airport. You have to get to the airport early. And what they're even planning is that they will start with just 4 airports. It means that some of those destinations within Nigeria, we should forget about them for now. So maybe the 4 topmost destinations in the country, they will focus on those ones. And
Lagos,
then we can,
Abuja to Lagos.
we can,
like
Port
maybe
Harcourt,
Port Harcourt,
maybe Owerri is doing well now. So they will first see how it works. My suspicion is that if those protocols are adhered to, and we can see that we have recorded some success along that line, then we can consider foreign flights coming in, because Dr. Sane also said that even the evacuation of Nigerians from outside this country has to stop, which means they are not in the mood now to allow foreign airlines to come in. It's those foreign airlines that imported and that brought the virus to our doors in the first place. So it's a good decision that they have taken, but they still need to continue the engagement with these airlines. The owner of Peace, the chairman of Peace, Air Peace, said, look, we are concerned about just simply payment of workers. He's not even talking that government has to assist in the area of payment, which was the suggestion that Bola Ahmed Tinubu made about 2 months ago, that we should help companies, critical companies, to defray the cost of paying salaries at this critical time. So I think government needs to look at that as we go ahead.
Somebody told me this weekend, if you are commuting from Lagos to Mowe, now they have to take 2-2. They don't take 4. So the drivers putting it into consideration. Instead of 200 naira, they now pay 600 naira per individual. They pay more per individual to go to.
They don't divert the cost.
To the passengers. Now, and you look at the economic implication of this?
That will happen with the airlines. Too.
Yes.
Because I heard that
We'll do Abuja 35,000, 30,000. But right now,
about 45%.
if
45 to 53%.
Yeah.
So if we want to travel to Abuja now, with 70,000, 80,000.
So you need to. So it means if you don't have any tangible thing to do in Abuja, there's no point traveling. And if you know that you are not going to make money, in
Just
Abuja,
go and get your God blesses you want for night bus.
that yes. So you live in the night and the morning
You do
already
get
Man, stop.
Honestly, because where will you find 80,000 for a 45 minutes trip?
That is what for now. Nigerians should just have it at the back of their mind.
It's going to be tough.
That is going to be really, really tough because if I am a bus owner, I will know that I'm going to buy fuel. Forget that they are going to bring down the pump price because I heard it's about 121.
But a lot of those
stations,
there are some stations.
You know.
Yes, most of them are not covered. Some people still sell at 130. So, but the bus driver that is removing 2 seats and not taking 2 passengers, we will also look at, okay, how do I break even one way or the other?
There's no subsidy for him.
No, there's no subsidy.
Push it to
the consumer or the passenger. And then the thing is, the number of times that he will be, moving from Lagos to maybe Mowe at 400 naira or for him to break even. Because originally, if he's making like a particular trip 10,000,
4 persons at the
4
road.
persons are out already, or more than 4, because it's half of the number. So you want to look at, okay, how do I, if I'm going for that trip, I'm not coming back, or if I'm going, I have to at least make 10,000 going, so that I'll know that if I'm going back, I already have money for my fuel for the next trip. So it's going to be very tough for Nigerians, and so it means the government will have to find a way to help small-scale businesses for them to survive. Now, the critical ones, like the airlines, which BQ has said, those ones also, they have people who are working. Don't forget, it is not just the crew members. We still have some
administrative staff
that
work the ground.
The people on ground that
those ones are more.
Always,
even more than
those ones are even more.
The people prepare the things that we eat.
Yes, those ones are catering. So it means those ones too, they don't even have business for the past how many days now? So
months.
Yes, months. So it means the government will have to look at it. The government will have to look at it holistically. So it's going to be very, very tough.
Even in our own industry, some newspapers, it's very difficult for them. They are even laying off.
Yes, already.
They don't have adverts.
Media houses forget. Have you seen how slim the newspapers are
Yes.
Yeah, because there are no adverts. You see, the media provides social service, if you look at it critically. And that is a critical area that really needs support. And if we watch the media houses die, then a critical part of us as a people is dead. So government has to consciously make moves
to intervene
to save some of the media houses from imminent death. You see, this COVID-19 has caused a lot of problems. Some people don't see it, but those problems are there.
Post COVID-19,
that's where you will now see the
when in the next 2-3 months, we are talking about, look at teachers of private schools.
Yes.
They are not being paid.
Because parents are not paying school fees.
Parents are not paying school fees. And they don't know when schools will be reopened. I'm not pushing that they should immediately reopen schools because we know our children are vulnerable.
Yes,
and it will be extremely risky to do that. But we have to admit that some people are going through a lot at this time. That is why, as a people, we must come together, defeat this pandemic. Let's not politicize it. Let's not trivialize it. There's no trophy won for saying it is not in your state. There's no trophy. I looked around, I can't find a trophy that you are going to come away with if you say it's not in your state. So let's not trivialize. Let's fight it as one people. That's what the Chinese did. All the repressive measures that they could take, they took.
Exactly.
To make sure that, look, they defeated this pandemic. It's not as if it did not. It extended to some provinces, but they were able to nip it in the bud. They worked hard, and Providence rewarded their hard work. But in our own case, we are not ready. They said, no, people should not travel interstate. Even today, they still repeated it. That interstate travel should only be something that's very essential. You are moving fertilizer, you are moving food. What are people? Somebody told me today, said, look, if I want to go to Abuja today, I'll go by road. That's why the PTF guys were begging the police. Because the police, the security agencies have refused to enforce this thing. So it has collapsed.
It's turned into business.
It has collapsed. So people are just traveling the way they like.
Even the curfew, they don't even...
And the transmission, I can tell you that the bulk of the transmission has happened through this
Interstate travel.
Just 20 local governments in Nigeria account for 60% of the transmission of the cases that we have. 20 local governments.
Asuquo, now a critical sector that we need to be back in full force, that's the banking sector. I still drive in front of banks. I'm not.
They've told them they can work.
Yes, I'm not. I'm not interested in entering any banking hall because I still see canopies. I still see long queues outside.
Exactly, and then even the social distancing rule or the physical distance, that one is even zero. You can't even. I've told, like we are saying behind.
But they have said, today that they can now go back.
They can now go back.
Full operations.
Full operations, you know. But the thing is, they still have to follow the guidelines and the protocols. You know, they can, because I don't know.
Once they do it, once they do normal
banking.
They do normal banking hours.
Okay, banking hours.
After a few days.
To be able to breach.
Maybe,
okay.
Yeah,
so to reduce that crowd.
People, yes, because there are so many people that want to go to the bank.
Yes.
You know, to carry
do
out
transfers,
interbank
transfers, do a lot of things.
And that one is even a problem.
You know,
because the ATM machine is even very filled. Anytime you go there, you see the
that's where a lot of the transmission.
Yes, exactly. Because there's nobody going there to. Nobody's going there to sanitize.
How many people sanitize? Even some banks put sanitizer close to the ATM.
But people will not use.
They just go there and
because
use it.
Do you know why? Because some people still think there's no
yes. They still.
That is why. So if you put sanitizer there,
there's a lot of cynicism.
If you put water for people to wash out with soap, they won't wash their hands. You know. So good that the banks are opening, but the banks must make sure that those people are forced to use sanitizers. People are forced to use water to wash their hands, so that this thing does not, spread.
It's about enforcement.
It's just enforcement.
You walk into Domino's now, you want to buy ice cream or a pizza for your children, and you are not using the face mask. They will tell you. They will tell you.
Yeah, a lot of.
And they will chaperone you. They will chaperone you to where the sanitizer is, so that you can use
Any big money.
So banks have security people stationed. The security people need to ensure that people go to the sanitizer, use it, and that they also wash their hands.
So
the case may be.
The sector of nightclub, hotels, parties.
Silent on that.
Those ones,
for Nigerians.
For now, no.
Saturday, Wambe parties, wedding.
Have you not seen virtual wedding?
Now,
people are doing wedding
by Zoom.
Wow.
So
that be cheaper.
For now,
I don't have to budget much.
No. Even my mom now. My mom said, "Forget about my birthday."
Oh, that 18th birthday.
Yes,
forget about what we are supposed to do.
Because we were even planning.
March 28th.
March 28th. Yes, because we were planning. I remember.
She said, "No, now don't even." And I can't blame her. COVID-19 strangulates old people.
Exactly.
When an old person who already has all those issues, heart condition, diabetes, arthritis, and all that, when they contract COVID-19, that's the end. It's usually very difficult for them to survive it. So what the point? You are coming from Lagos and other places, you want to go and do a birthday for an old woman. Some of the people coming, you don't know if they are carriers. You know?
And they
So
have
that is the
enough
thing. So
reason to
it may be
resist it.
blessing in disguise to simply not do a party.
Any
at
big
this time.
gatherings now?
No. You can't even church. To go to church now, since I have not gone to church for a very long time.
And you are not dead.
I'm not dead. I think I have until they say, oh, they have a cure.
Some people will say, Asuquo, you know, Nick, she tell them.
Oh yeah. Even if I have 1,000,000 hectoliters of anointing, I know that it's dangerous at this time.
At this time, you know,
go to
I
such
think
big
people should
gatherings.
just be careful. Let's just see how this thing will end, because it's going to stay with us for a very long time. If there's a cure, fine. But the thing is, for now, large gatherings, no.
You can't be too careful.
You can't. You just can't. You just can't.
Okay, thank you so much, Asuquo James. Thank you for your contribution today.
Thank you.
BKO is a Monday. We have till Friday to go. And that's our offering today. Join us tomorrow for another episode of the program. You can watch Journalists Hangout on your platforms showing on the screen. We're on YouTube, youtube.com/TVC News Nigeria. Our feedback channel is Journalists Hangout at tvcnews.tv. I'm Ayodele Ozugbakun. Bye for now, and God bless Nigeria.